Mr. Lakestone.
Thank you, Mr. Speaker. As I mentioned during my member statement, my questions today are for the Minister of Health. Again, I'd like to thank the Minister for making his announcement about the mental health surveillance system. It is clearly needed across our territory in developing mental health surveillance system to monitor trends and identify individuals who need urgent mental health and social support. The Minister had indicated that the program was launched in Commute first and then in Iqaluit in November of 2023. I'd like to ask, can the Minister highlight some of the impact that this program has had since it was launched? Thank you, Mr. Speaker.
Honourable Minister of Health, Mr. Ming.
And thank the member for the question. We're quite excited by this system and in terms of expanding the rollout to more communities. It's literally happening as we speak in terms of adding more communities. And so the mental health surveillance system, I think one of the biggest benefits to it to date has been ensuring a greater attention to detail, I guess we could call it, in terms of the case management. It's strengthened our case management in terms of providing reminders and providing timeframes within which health professionals are given notifications regarding specific clients and in terms of having them followed up with. So we've seen improvement in case management and handovers, supporting continuity of care, and we've also benefited through this system because it provides accountability and better documentation for follow-up work.
For supplementary, Mr. Lakestone.
Thank you, Mr. Speaker, and I'd like to thank the Minister for that response. I'm sure that this mental health surveillance system will have exceptional benefits across the territory. Mr. Speaker, as I also indicated during my member statement, and in fact on many occasions, it's a fact that the minority of the population does commit a majority of the violence. And in addition, Mr. Speaker, there's so many people suffering in silence and self-medicating with alcohol, especially here in Iqaluit. And as the RCMP are likely the frontline workers interacting with these individuals the most regularly, I thought it was appropriate to ask the Minister of Justice and the RCMP to collaborate more effectively with other GN agencies such as mental health or social workers. So I'd like to ask, since 2023, since I made that request, to have more collaboration with interdepartmentals to address these individuals, what has the Department of Health's mental health workers done to assist these individuals who have fallen through the cracks? Thank you, Mr. Speaker.
Minister of Health, Mr. Ming.
And in terms of the interagency aspect of the mental health and addiction work, it is an important one. We don't want to have departments or offices within Iqaluit, for example, to be working in silos. And so looking at our Iqaluit mental health and addictions team, they do maintain strong linkages to other departments, the staff within other departments. In terms of the mental health surveillance system, Mr. Speaker, we do include data from Royal Canadian Mounted Police in terms of what we're working with. And looking at here in Iqaluit, the outreach team, mental health and addictions outreach team, they do work with other departments in terms of providing guidance around mental health issues and clients. And we do have a footprint that extends beyond just our facilities. We're looking at outreach services through an after-school program that exists, through the work at the men's shelter. There's also work at the drop-in center with youth. There's a weekly program at the Qimabik shelter operated by YWCA, as well as monthly mental health awareness programs. And it's an important component of our work to work with our partners at Department of Justice on behalf of Nunavummiut. Matno Kaktichi.
Second and final supplementary, Mr. Lightstone.
Thank you, Mr. Speaker. Again, I appreciate the Minister's response. I'm glad that there's a footprint beyond mental health facilities. Mr. Speaker, looking at the the RCMP's annual figures for the Minister's information, in 2024, there was over 2,730 individuals, detainees, held at the RCMP station. And in 2023, there was over 2,800 individuals held as detainees. And Mr. Speaker, it's often referred to as a drunk tank for a reason, because majority, if not all of these individuals are intoxicated. And I'm sure that there are quite a few individuals that repeatedly visit these detention cells. I'm glad that the Minister had indicated he does share data with the RCMP. And I'd like to ask specifically if the Department's mental health team shares information with regards to the RCMP detention cells here in Iqaluit. Mr. Speaker, I think it's safe to assume a lot of these individuals are suffering from alcoholism and could greatly benefit with the attention and support that can be provided by the Department of Health. Thank you, Mr. Speaker.
Minister of Health, Mr. Main.
It's through our interagency information sharing protocol that we're able to share information between agencies regarding individuals. And so the Royal Canadian Mounted Police are signatory, as is the Department of Justice, to that protocol. And it's one that is important to our work, and looking at the services we're providing here in Iqaluit in terms of the clinical side. We have what amounts to the greatest availability of clinical mental health services anywhere in the territory. So we have, a number of facilities that we're providing mental health services from. We're providing assessment, crisis intervention, stabilization services, outreach support, as well as psychotherapeutic services. And just encourage Iqaluit residents and any resident of any community, if you are feeling that you need help, whether it's with an addiction or another personal issue, there's always someone willing to listen. And encourage Iqaluit residents to reach out to one of our staff across the city if you are feeling like you need to access addiction counseling or just need someone to talk to. It's important to have an open door and an open hand to those who need help. Thank the member for raising this important issue.
All questions?